Good morning. Thank you all for being here at the University of Michigan School of Public Health. We're so pleased to have you here today. Thank you for braving the weather. How many of you are from out of state? Not from Michigan. Okay. How many of you are from a state with warm weather? Okay. So it doesn't always snow in mid-March. It does get warm eventually. That's about as reassuring as I can be for you about weather at the moment, but I promise we do get some sunshine and warmth here too. My name is Angela Beck. I'm the Assistant Dean in the Office for Student Engagement and Practice here at the school. I'm also faculty in the Department of Health Behavior and Health Education and a very proud alum of our master's and doctoral programs. My pronouns are she, her, and hers. You'll see you have space on your name tag to add your pronouns if you like, and there's some information in your folder about this if you have any questions. Congratulations on your acceptance to our school. We chose you, and today we're going to work hard to show you why you should take the next step and choose Michigan Public Health. I would also like to welcome your guests. We understand that the choices made by our admitted students will impact more than just one person's future. We look forward to earning the trust of the parents, partners, friends, and family members who have joined you today. In my assistant dean role, I work with staff across admissions, career development, student affairs, public health practice, and undergraduate education. You've already worked with our admissions team very successfully. Today you'll learn more about your academic future, including the curriculum, the faculty you'll work with, as well as the student experience and career opportunities. This morning you're going to spend about the next 35 minutes in this room with speakers who will dive deeper into what it means to be part of the Michigan public health community. We want you to leave today fully understanding the network of support that exists for you here at our school. We're all invested in your success. We all understand that ultimately your success leads to a healthier world for all. We have a great day planned for you today. You're going to spend the majority of the day with your admitting unit, your department, and you'll get to know their faculty and staff, as well as connect with current students and understand their experiences. Meanwhile, your guests are going to learn more about how Michigan Public Health will support your passions, your career interests, and how we stay connected and supportive after graduation. This afternoon, there will be a short session on financial aid, and then we'll end the day with a social hour at campus favorite Cottage Inn Pizza. Here at Michigan Public Health, our mission is to pursue a healthier, more equitable world through education, research, and action. We work with compassion, innovation, and inclusion to create meaningful, lasting impact. Each day, our faculty, staff, and students work toward this mission. We're looking for our next class of visionary thinkers to join our community and live out this mission with us. We would love for you to join us. To envision your future, I want you to understand more fully who we are as a school. At the end of 2018, we put together our year in review. It's a powerful look back, and it demonstrates the breadth and depth of our community. So let's watch this now together. This may give you a better sense of how you will be challenged and how you can grow here at Michigan Public Health. So what will our story be when 2020 and 2021, when you may be graduating from this institution? How will you be part of that narrative? Let's get to know the School of Public Health a little bit more. Here are some data to consider as you weigh your options. The School of Public Health is one of 19 different schools at the University of Michigan. Michigan has 97 graduate programs ranked in the top 10 according to U.S. News and World Report. 97. There is some flexibility in the curriculum to take courses outside of the School of Public Health in some of those graduate programs. So when you come to Michigan Public Health, you get the whole university. Now some numbers about our school. We have about 1,000 graduate students here at Public Health. We also have about 150 undergraduate students. There are 170 faculty members here at the school, and our faculty are renowned across the world. We have 350 dedicated staff members who keep our school running. Our research portfolio is about $85 million per year. And that makes us, it gives us the most research dollars per faculty member on this entire campus. By the way, the University of Michigan is ranked as the #1 public research university by the National Science Foundation. So if you are interested in research, we have more than 30 research centers here just at the School of Public Health. Our alumni network is extremely strong at more than 16,000 people. They reside on every continent on the planet except for Antarctica. We're still working on that one. There's a lot more to discover here throughout the day. Please ask questions, ask lots of questions, and enjoy your time here. Thank you very much. I am pleased now to invite Nichole Burnside, our Diversity, Equity, and Inclusion Program Manager, up to spend a few minutes with you.
Good morning. Good morning. And thank you all for being here today. I'm Nichole Burnside. I have the privilege of being the school's Diversity, Equity, and Inclusion Program Manager. My pronouns are she, her, and hers. At the University of Michigan, our dedication to academic excellence and the public good is inseparable for our commitment to diversity, equity, and inclusion. It is central to our mission as an educational institution to ensure that each member of our community has a full opportunity to thrive in our environment. For we believe the diversity is key to individual flourishing, educational excellence, and the advancement of knowledge. Here at Public Health, the commitment comes to life in several ways. Excuse me. First, it is the learning environment we have created and that we work to evaluate and make continuous improvements. The opportunity to participate in workshops and trainings for our students, along with faculty and staff, enriches their experience here at Public Health. These offerings educate and create space for dialogue and understanding. One innovation we've introduced this year is a peer review of teaching. So peer review of teaching is a method where we ask our faculty members to make an introspective view at the way they teach their classes. And it equips our faculty with tools to enhance their teaching methods. The world continues to change, and we need our teaching methods to evolve to reflect that we ensure reaching out to all of our students. No two student journeys at Public Health are alike. It is our differences and appreciation of our differences that make us stronger. We empower our students to participate as citizens of our school through a variety of ways. We support mini grants for students interested in creating a diverse, equitable, inclusive environment. With the support of mini grants, a current student put together a discussion on mental health topics. It helped us gain more understanding on the mental health needs of our students. Students are also an integral part of our Diversity, Equity, and Inclusion Committee. And you'll learn more about that in the department sections of how you can get involved in your departmental DEI committee. They are active. They lead efforts on inclusive teaching for graduate student instructors. They help with recruitment of students and create unique and original programming, such as some programming we have coming up on weight bias. One of the things I appreciate so deeply about our students is how passionate they are for others. This is very selfless and caring community. There's also incredibly committed to becoming public health professionals, gaining new skills and new perspectives. That manifests itself in a most concrete way in our robust student organizations. There are more than 30 student groups here at Michigan Public Health run by students and passed on from year to year. All of our organizations build communities within our community and create places for inclusion, for growth, and for diverse perspectives. I'd like to share with you the perspectives of some of our student org leaders and how these organizations empower our students.
As a first-generation Native student, I often find myself being the trailblazer.
As a person of color, it's kind of difficult to find your community within any graduate program.
It was a struggle, like trying to find where I belong.
Not a lot of students look like me. Not a lot of male students look like me especially, so finding other black male friends, that was really essential.
La Salud focuses on building community within the Latinx community at the School of Public Health.
SOD stands for Public Health Students of African Descent. I think that community aspect is key. It's a family.
SGDPH stands for Sexual and Gender Diversity in Public Health, and I suppose the name gets at it pretty well.
The Health Policy Student Association, also known as HPSA, we essentially strive to cultivate a interprofessional community for students beyond SPH.
I am the president of EHSA, which is Environmental Health Student Association. We are a group of students that work together, hosting events where we can get the faculty and students to develop a more professional and outside of school bond.
STATCOM is a volunteer student organization housed in the School of Public Health that provides pro bono consulting services to community partners.
Our biggest effort that we do every year that's really unique to HPSA is our Advocacy Day. It's a 6-week intensive advocacy training course that culminates to a day in Lansing meeting with legislators on a policy issue that we find important.
STATCOM is really committed to having a diverse project team for each of our consultations. We always have both domestic and international students, older and younger students.
We try to provide resources and opportunities for our members' professional development and programs here and there that kind of talk about current issues affecting the community.
Having become involved at Michigan and at the School of Public Health, it's just a very positive network and atmosphere that I've created for myself, and that's something that I want other students to experience when they come here.
I suppose thinking of students who are going to be coming to the School of Public Health, especially those who identify as a sexual or gender minority, I want them to know that there are other people at the school who want to, see them and be seen with them and have community with them. There are others who want to meet you.
Family is there for all different aspects of your life. They're here to support you when you're down, when you're up, but also to encourage you and push you to go further than you ever thought you could go. And I think that's what Facade really is. It's a family.
So in our video, you heard the word family. And when there are horrible tragedies in the world, we move closer together. Tonight, our university will gather on the Diag to honor the loss of the life in New Zealand. In this community, we want you all to thrive. The opportunities abound, and there is still plenty of room to build the future and create new opportunities. Thank you for your time, and thank you for your consideration of Michigan Public Health. I'd like to invite up Shelagh Saenz, our Director of Michigan Public Health Careers. Thank you.
Welcome, everyone. So by a show of hands, let me know who of you are eventually going to get a job. That's what I thought. So you're here ultimately to get a strong education that's going to prepare you to go into the workforce for a job that you're going to love to do. And so today I just want to tell you a little bit about career development and what we do here, and hopefully get you interested in pursuing and continuing their career here at the School of Michigan, or University of Michigan School of Public Health. Let's see. All right, so here's a quick overview of our last career outcomes report. We had 96% of recent grads who report they were employed or pursuing advanced degrees or doing a fellowship, or they simply weren't looking. Usually it happens within 6 months after graduation. And then we also have the entry-level salaries. They do vary by department, by how many years of experience you have before coming into the program, by the sector you're going into. But typically for entry-level people going straight through, it's usually around this range. If you want more information, we do keep these annual reports that are available on the School Public Health website. And you can look in by department. They have 3 years worth of data. And you can find all sorts of helpful things like who's doing a fellowship, or what is the average salary range? What sectors are they going into? What employers are hiring our students? So you can always go into these reports for more information. One thing I want to note also is a lot of schools and programs that you might be also exploring don't always necessarily show this information, but I feel career outcomes are really important for you to kind of know, like, what is the success of the people coming out of the program. So this is something I hope you will take a look at and consider. All right, so we also have a website called Michigan Public Health Careers, and that's our jobs portal. And it has tons of jobs and internship postings. Jobs, we probably post several thousand. Internships at several hundred. So there's always opportunities up there among many other resources that you can find these opportunities on. We have some bells and whistles on the system, which is nice because we have an email notification system, so you get emailed if something matches your description or criteria. We have electronic resume books, so you can upload your resume. We create resume books and send those out to employers, or employers will log into our system and download resume books. So you have access to employers that way. We have an online document library that you can access 24/7. Employer database, really, I want to say last I looked it was about 6,000 employers were in it. And we also have a postings archive, so we can hold on to these so that students can go and do some research and find out, okay, what skills are they asking for? What employers are really hiring a lot? So you can do a little bit of research there in your pursuit of your career. A question I get a lot is, will attending the University of Michigan help me achieve the career I want? And I would say yes, for a couple different reasons. One, we have such a solid reputation. Our school's been around for a very long time. People know our students, and our students are successful. So I think the solid reputation is something that does enhance your degree here when you go into the workforce. Secondly, we have a strong alumni base. I mean, we've been around a long time. I have students come to me saying, yeah, I was doing a job interview, and they ended up being an alum of our program or alum of the University of Michigan, and we connected. I hear that very frequently. We also have one of the largest alumni groups on LinkedIn in the world. The University of Michigan does, by far. It's the largest. And as well as our own School Public Health LinkedIn group, it's one of the largest. So there's something to be said about having alums who are out there in the field who know our program, and they're in positions that they're also hiring. So our alumni base is definitely a factor for our students as they go into the workforce. Practice opportunities. So we have an Office of Public Health Practice, and this is really interesting because you will learn great things in your classes, but here's an opportunity to put these into work on the ground in different situations and apply those skills. So the practice office will be doing, they help with emergencies at local public health departments. Over spring break, they were at the border of Mexico doing some health assessments. In the past, they've also worked with disaster issues. I know a couple years ago they went to Puerto Rico after the hurricane, and they were doing some health assessments there too. So this is a really cool opportunity to apply those experiences, get some more on your resume if you don't have a lot on your resume right now. So it's a really great office to be a part of. Research opportunities. We're a large research university, and there's research opportunities abundantly here, even not at our own school only, but there are. But I mean, nursing, medical school, there's a lot of other schools that also hire our grads for their research programs. So if that's something you're interested, there's going to be opportunity there. And lastly, our recruiters, when I say, so what do you like about our students? One of the things they say is, I like how interdisciplinary they are. They are focused in their area and they're well trained, but I also like that they can speak to the biostatistician and understand that language. Or they can work with a health behavior person and understand kind of what content they need to address the message, tailor the health message to the right audience. And so this interdisciplinarianess that is part of the coursework is something that definitely, I think, benefits our students. Some other available resources, I already mentioned our job and internship postings. We'll do panels, alumni panels, sometimes employer panels. Employers will come and do information sessions, and they'll tell us what it's like to work in that sector, or what their company's about, to get students interested in the work that they do. Advising is by far our #1 requested service from our office. We do lots of workshops and programs, and recruiters will come and actually do interviews here as well. Last year, I want to say we had a pretty robust program. About 60 recruitment visits happened, and networking activities. I think that's the problem here at the University of Michigan. There's so much that goes on in any given night that you literally have to boil that down to really what's important to you, because there's so many opportunities to go out, meet people, meet speakers. So the networking here is pretty great. So at Michigan Public Health, we offer you great career resources, job fellowship internship opportunities, career advising and assistance. And I really have to say that honestly, the faculty and staff here care about your success. And so that's something that we do get very invested in, and I hope to see you in the fall. Thank you very much.
Thank you, Sheila. Hello, everyone. My name is Ancira-Corrigan, and I'm the Director of Student Affairs at the School of Public Health. I also want to first ask that you pardon my voice a little bit. It's a little raspy. I'm getting over a cold, so I'm sorry if I sound a little scratchy when I'm talking. But I have a few minutes to talk with you about the student experience here at Michigan Public Health. And there's me. So let's see here. Your experience at Michigan Public Health will be shaped by many factors. Perhaps the most obvious is your academic journey, the classes that you take, the faculty that guide you, the peers you study with, and the curriculum you navigate. While you're with your admitting departments today, you will get a thorough overview of that journey. There is also the infrastructure of support for Michigan Public Health students that will have a profound impact on your experience. Things like, where do I study? How do I ride the bus? How do I find a social network? The network of support at Michigan Public Health will help you navigate that space between academics and life. Let's see. Within our academic departments, there are program coordinators, and they are staff who, in addition to the school level support, are here in each of your departments to be part of that network. You can see them all on the screen behind me, and you'll also spend most of the day with them in the department sessions. At the school level, there are many facets to our network of support. We are here not only to support you academically, but socially and mentally. Our student programming includes everything from financial workshops to pre-exam gatherings to decompress that we call stress busters. We also work very closely with student organizations and have social groups for first generation and international students. At Michigan Public Health, we have an embedded counselor from the university's counseling and psychological services that's here solely for our students. We can also assist with food insecurity and financial emergencies. When you come here, you bring your whole self, and we are equipping ourselves to meet you. The peer network that you have at Michigan will also impact your time at Public Health as a student and also as future colleagues in your professional network. And I'd like to ask two of our students, Brianna Jacobs and Patrick O'Dowd, to introduce themselves and tell you a bit about their experiences. Come on up.
Hello. So I'm Brianna. I'm a second-year HPHE here at SPH, and I just want to talk to you a little bit about my experience at Admitted Students Day 2 years ago, I think. Yeah. So I did my undergrad at the University of South Carolina, and I'm also from South Carolina. So coming to Michigan was a little bit daunting to me. I grew up in Canada, so I was used to the cold, but Michigan has such a big name that it was a little scary. I quickly got over that and really enjoyed my experience here. I met some of my best friends in the program and made really great connections with some of my future classmates. And it actually helped out with class projects later, because grad school is all about group projects. So you got to kind of learn people's interests and let that guide you in choosing your group partners for the rest of the year and semester. So that was a really great networking tool that happened at Admitted Students Day, and It's also good to just make some friends and meet some friendly faces that you'll see here in the fall if you choose to come here. I also encourage you to talk to current students because we're here to serve as a resource for you, and we're pretty much your ticket to all things Michigan. We'll tell you about, like Adam was saying, like the buses, and if you want to know where to eat, the best places to go, what to do on the weekend. That's why we're here for you today. Your department program coordinators are actually going to be your curriculum resource, so talk to them, ask them any questions, and they're pretty integral to the decision process, at least they were for me. So ask them any questions you have, and they'll be happy to respond. So I came to Michigan for a variety of reasons, but one of them was really my experience at Admitted Students Day. Everyone was really welcoming, and it was nice to kind of feel heard and have my experience and interests appreciated. So that was one of my major deciding factors. So while you're here today, I encourage you to make some friends, shake some hands, and see if this is really somewhere you can see yourself for the next 2 to 3 years.
Hello everybody, my name is Patrick O'Dowd and I'm a first-year Master's of Science candidate in toxicology within the Department of Environmental Health Sciences. So I came here not from the University of Michigan for undergrad like many of you, from a small university in Livonia called Madonna. There I was a forensic science major, so something that's very unrelated to public health and medicine in general. However, medicine and public health have really been always something I've known I wanted to get involved in. So my decision to come here was really based on all of the enormous amount of resources that you guys have here and the ability to get involved in things that like truly transcend what you're looking to do individually. So for example, since I've been here, I've been elected to Public Health Student Assembly, which is like the student government of public health. And then on a larger level, Rackham Student Assembly, which is like the overarching student government for all of the Michigan graduate programs. Additionally, I work in an epigenetics lab here at the university within EHS, and I also work within the Department of Anesthesia as a research assistant in Michigan medicine. Choosing to attend Michigan is definitely one of the best decisions I've ever made, not just because of the resources, but the people I've met, the education I'm receiving, and then just research in general. Like if you're like me, I love research, and here you can do a ton of it. So this decision will not only be something that has a lasting impact on my personal life, but also eventually in my professional life as I move on to hopefully medical school after this, we'll see. And then, so like I said, and Brianna said, if you guys have any questions, truly reach out to us. We're gonna be here all day. I'll be in the EHS panel, so if you're EHS, you can ask me some questions. So yeah, welcome to Michigan. So now that you guys have gotten to know us a little bit, we want to get to know all of you guys a little better. So fair warning, we're gonna do an icebreaker. As Nichole mentioned earlier, our diverse experiences and perspectives are what make us stronger to address public health issues. So now we're going to spend 3 minutes on this activity, and we want you to spend this time with 3 different people who are hopefully you want to talk to sitting around you. Behind us on the screen, we're going to pose 3 questions to you, and we want to make it through all of these questions in 3 minutes, hopefully. Or we want, hold on.
Yeah.
Hold on. We want you to make it through these 3 prompts in about 30 seconds. So first, what is your name? Second, where are you in your journey right now? Are you finishing up your bachelor's degree in undergrad? Have you been in the workforce for 10 years? We want to see the picture that you're going to paint for us. And then finally, we want you to share your public health pursuit. What got you interested in public health, and what are you hoping to impact? And then if you're here as a guest, instead of sharing your health pursuit, please share what you hope for your loved one today and in the future. So right now we'll spend a minute, turn to your neighbor, and you should be able to get through these 3 prompts in the next 60 seconds.
Thank you all for being so open to getting to know one another today. We really appreciate it. Building a network in public health is really important, so we wanted to let you start building your network today. As Patrick mentioned before, we'll both be around all day if you have any questions.
We have a busy day planned for you. I'll try to rush through the last few minutes because we're behind. Here's what the rest of the day will look like. We will wrap up this session in just a few minutes, and everyone will head out to the different rooms to meet with academic departments for an hour. We will have our staff and students available to help you navigate the building. I just wanted to make a note that the School of Public Health is composed of 2 buildings, and we have a tower that joins the 2 in the middle, and that crosses over Washington Heights, the street that's just out here. So we will do our best to keep you inside today as you're crossing the street. We are currently in SPH 2, and we will be heading to SPH 1 in just a minute. I also want to encourage everyone to make sure that you're following us on social media if you're not already. We are on Instagram, Twitter, and Facebook, and all the accounts are at UMICH-SPH, at UMICH-SPH. I just wanted to say thank you to all of you for being here today, and we are going to exit the room based on where you are going next.